Okay,
If you
that's
work
fair.
for an agency, you have meetings, you have uh, supervision, you have other things that gets involved. Yeah,
Hmm.
direct patient contact is not usually more than that.
Hmm.
Yeah.
Okay, interesting. And in your experience, do you have a lot of patients or do you have like the same regulars? Like, do you have 20, 30 patients that you treat just them? Or do you have,
No, no,
do
no.
you see everyone else?
Nowadays, most people come for short term.
Really?
They come between 3 sessions to 10 sessions, and
Mm.
that's about it. And then they go. Yeah, some people just come one time and they just have some questions they want to ask, and they just move on. Yeah.
Isn't that a bad thing? That they're not committed to therapy?
No,
No?
no.
How so?
People have different needs, you know.
Yeah.
And even with some of the more severe depression and all of that, nowadays long-term therapy just doesn't exist. Yeah,
Really?
yeah.
Uh, Is that a good thing or a bad thing?
It's a good thing. It means that the field has improved, so we can treat people faster.
Hmm.
It means that people have, with both medication and with other things, that they can move on with their life. They're not stuck in this difficult area. Yeah.
But do you think that someone who has severe depression, which is like a serious mental illness, if they go in for one session of therapy, do you think that that person could be set on the right trail with only one session?
A person with severe depression probably needs to have medication.
Mhm.
So they have to be evaluated for medication.
Mhm.
The best technique we have now for depression is cognitive behavior therapy.
Mhm.
So usually they come in for cognitive therapy, they go 10 session, and then they go and then they come back and they get reevaluated. And also some people are using other techniques. There are ketamine, there are other techniques that they use
Mhm.
to get rid of depression.
See, that's bless you. So the field that I'm looking forward to go into is a field that requires the least amount of medication. Because a personal belief that I have that I kind of developed over the last few years is that I believe that medication in some cases actually does some good, but I believe in most cases, especially now these days, is just used as something to numb the problem and not actually treat it. Like if someone has, like I had ADHD, like I still have ADHD,
Mm,
and my therapist prescribed some Ritalin for me.
mm,
And so I never actually dealt with my ADHD like in a healthy manner. I just kind of numbed it down so I could focus on school. And over time, it just got worse because I had to just take more and more and more because I had never got used to just one specific dosage. I started out with a tiny bit, like one pill a day, then two pills a day, three, four. And then I reached a point of I couldn't live without these pills. Like I had to focus in school, I had to focus in my life, and I felt the ADHD getting worse actually because I wasn't used to focusing without the pills. And it was getting so bad that like even without telling my parents, I had to like kind of quit cold turkey without like lowering the dosage and everything. And the first few months that I actually quit those drugs, uh, it was very hard, because I
mm.
couldn't focus on
Oh
anything.
yeah, they're very, yeah.
And,
Ritalin is a
and
very difficult.
exactly,
Mahir John, uh,
yes.
Mahir John, one of the things that you need to realize is like somebody that has bipolar disorder.
Hmm.
There is no way a person with bipolar could be treated with therapy or and also to get, if you talk about suicide and bipolars,
Hmm.
it's a very, very, very high rate of suicide in people who are bipolar. But
Hmm.
once they are on medication and they are focused, it kind of, it has to do with enzyme of the brain. It has to do with it really helps them. Some of the people who have OCD, severe OCD, they are totally disabled if they don't go on medication. People who are highly anxious is the same way. They cannot function, they cannot concentrate, they just are miserable about it. So
Yeah.
I think medication has really been a great help in the field of psychology. There's always room for, people need help in life matters, but medically, if they require medication and if they're improving all the time, it really, really is helpful, and it keeps them from not being dysfunctional and be able to function in society and move on. Yeah.
But so you don't agree that a lot of times people just get dependent on these pills rather than being able to deal with their actual problems?
Well, with Ritalin, I can see that people like to use more sometimes, but with other things, I don't see people thinking that, oh, I just need to take more antidepressant. No, they don't do that.
Really?
With bipolar, it's not happening that way. No.
So, but Ritalin is considered an addictive drug, but like with drugs like ketamine, which is prescribed for mental illnesses, that is one of the most.
Ketamine is actually injected, and they only use it like 4 times. That's all. And it really helps. It's amazing how that when people go 4 times to the clinic and they get, it's injected. They have to sit there for an hour, and it's injected into your vein. It's amazing how functional it makes some of the people that have depression. Yeah.
Is there a study that suggests that they don't get too addicted? Because like I understand that, if you go to a clinic and have to have that injected to you, it kind of limits you from actually getting addicted because you don't have.
Exactly. You don't have access.
But you could also get ketamine from drug dealers, like very easily, actually. So what is stopping them from, kind of seeing ketamine as the answer to their problem?
Ketamine in form of what? In form injectable?
Injectable. I don't know how you could use ketamine.
I don't think ketamine is. You can get it from your drug dealer.
You can't?
Because there are no pills, and it's actually used to put people under, for anesthetic for patients to have surgery. So,
but so did morphine, and people are still using it for like.
No, that's a different story. No, that's not it's not a part of the same kind of. It doesn't give you euphoria. Morphine numbs the pain and gives you euphoria. That's a totally different.
Ketamine doesn't give you like a euphoric.
Nothing.
But it does numb you down.
No, it doesn't do anything. It does not numb you down. All it does is after, with some people, not all people.
Yeah.
After you use like 4 times, 5 times, you just don't feel depressed. You feel more energetic. You talk more, but you don't feel like you had anything done. There is also a system that they use. What do you call it? Magnets on the brain. They use it actually at UCLA. There's certain part of the brain that if you put magnet and the electromagnetic field is increased, it reduces depression. So there are a whole bunch of new techniques that, all the talk in the world, it just doesn't help. There are some things that needs to be done with other methods. Yeah.
So does ketamine work on dopamine receptors in the brain?
I don't know. Nobody knows how it works. They just know that after 4 or 5 times, it's amazing how it affects it. Yeah.
Okay. All right. Thank you.